Hello everyone, my name is Jennifer Day and the course is Medical Ethics with Professor St. Pierre. The topic of my presentation for the Make a Difference is autonomy. And please disregard, I'm a little sick, so if I sound a little stuffy, please forgive me. What is autonomy? Autonomy is an idea that is generally understood to refer to the capacity that is one's own person to live one's life according to reasons and motives that are taken as one's own and not the product of manipulative or distorting external forces, to be in this way independent. In simpler terms, autonomy is when a patient must make their own decisions and for those decisions to be continued on if the patient becomes incompetent. The problem is autonomy is not being practiced in the way that it should be from the medical providers. They still provide based on what the patient wants, just not 100% effectively. Why is it important? The importance of autonomy is to respect the patient's wishes and requests. The patient can decide what happens to their body. The principle of autonomy is that every person has the right to make decisions about their own life. Patients have the lawful right to accept or refuse treatment. Where is the problem occurring? The problem is occurring in the setting of the medical field. This is because this field works directly with patients that help influence the decisions about the patient's health care. An example is a doctor providing a patient with the treatment or therapy they could use. This also means, let's say a patient has diabetes and they're having pain. You can't just go tell them, oh yeah, this works for my other patient and this is what I've been using, so this may work for you. Because every patient is different and everyone comes with their own medical issues, so you can't prescribe the same things for each person. Possible barriers. If the patient never provided details as to what will happen to their body when they are in the medical provider's care. The example is the Terry Shivavio case. Terry was incapable of making a decision about her health when she was in a persistent vegetative state. Therefore, her husband made the medical decision of depriving her of nutrition and dehydration because it was what she wanted. The lack of information. If the patient is not given all the information regarding their health, they cannot make certain decisions. I found this picture on Google, and it's basically all the healthcare providers together and the patient alone. So if the patient is not understood or not being able to express what they're feeling or any concerns that they have, this is a barrier because the healthcare providers all are educated and they know, and they are not given this access to the patient. Ethical issue. Since autonomy involves respecting each person's freedom to make their own decisions, it is an ethical issue. In the medical industry, the patient makes the ultimate decisions about their own method of treatment, prescription drugs, as well as additional concerns. Considering it takes into account each person's experiences, values, and future results, this is a key premise, because it is critical to honor and follow each person's wishes about their medical care. So this picture is also found from Google. Basically, this is the patient, and they are expressing concern or communicating with the medical provider, and is going through the ears. So it's just important to be able to communicate, because once you say something, you're saying it, but it just has to be able to be comprehended, because you can listen without comprehending. So it's just important that the patient is communicating to the medical provider. Exploring the options. What should we do? Communication, education, and patient comfortability. So communication is basically making sure that all parties involved understand what is going on. This refers to the patient, the family, and medical providers in the event of medical emergencies. There's already a set plan of what will occur following the patient's health. Changes are not to be altered without written consent from the patient themselves. Although age may be a huge factor to consider, it is crucial to accept any possibilities. By doing this, mistakes, medical errors, and disappointment is prevented. Education. The patient needs to be provided with all the necessary information about their health condition. This is treatment options, potential risk factors, and beneficial outcomes. This allows the patient to make informed decisions because they are aware of the ins and outs of their medical condition. Ensuring patient is comfortable. The patient must feel comfortable expressing thoughts, concerns, and fears about their health treatment. Misunderstandings are more likely to be prevented if the patient feels comfortable asking questions to the medical providers regarding their health. Let's say you guys are in the medical field and you guys are the patient, it's important to be able to ask your doctor questions about your health. If not, it's like something was in the way, or like you go home not knowing, because Google can't tell you everything and Google doesn't know your exact health condition. So you have to feel comfortable being able to ask your medical provider questions about your health, and you should feel comfortable doing so. Act. What should be done and why? Communication is the most effective way in making a difference. To make sure that all parties are aware of the situation, it is vital to discuss the problem and find a solution. Communication allows for the discussion of the medical conditions, available treatments, and possible outcomes. The possible risks. In terms of their health, educating the patient will be more advantageous because it will be enabling them to make more choices that will prevent harmful errors. This needs to be done for the medical professionals to give the patient any relevant information directly. Trust can lead to successful outcomes, but is not guaranteed. Patient satisfaction are promoted by communication. So, if you communicate with your patient, there should not be any like, oh, I didn't know this, I didn't know that. It just prevents all of that and it makes everyone happy. References. These are the sources that I got all my information from. So if you guys wanted to like learn more information about it, here are the websites. But I hope you guys enjoyed my presentation and were informed on the topic of autonomy and how we can make a difference in this world. I hope you guys enjoyed, and I hope you guys have a great week. And thank you.